Why won't the surgeon operate on me? That's a very common question asked of me, and I do see it in the comments in my blogs and also on my YouTube channel. Well, it is actually pretty straightforward. It all comes down to risk. Do you have a realistic understanding of the outcomes of the operation? Do you understand the needs that you need to do as a patient to actually make the operation successful? And will the operation provide you long-term relief? If these are not appropriate risks, the surgeons typically will not offer you an operation. Now, they will operate on you if the operation is more predictable, if there's more immediate relief after the operation so the patient can tell the difference, if the operation is less complicated, if there's an easy recovery, and if there's a less demand on the patient on what they need to do. And finally, we also need to talk about being realistic. If you're realistic, a surgeon will more likely do the operation. And remember, if the surgery provides longer term benefit, the surgeon will also likely provide the operation. And finally, there's something you need to understand. Every surgeon also has to think about their reputation. If you do an operation and things go badly, it may reflect on you long term. So if it's a young surgeon or newer surgeon, they may be less likely to take risks, although they're often put into that position. So the reality is there are things you can do to express to your surgeon that you understand the need for the operation. You express realistic goals. You understand that this operation will improve these things, but may not make a difference on other things. You'll also be able to demonstrate to the doctor that you're willing to do the things that will help you get better. If you demonstrate before the operation that you do things like losing weight or stopping smoking or decreasing your narcotics use, your surgeon is more likely to think you'll be compliant and take the risk with you. And finally, you need to express to your surgeon that you appreciate the risks of the operation and you understand that there's no guarantee. And despite that, you want to proceed and you will take the risk along with the surgeon together as a collaboration of the process. The surgeon wants to know that you also will do all you can to make the operation a success. I know these are common sense things, but if you express these things, I think your surgeon will be more likely to go along and take the risk with you. This is Dr. John Shim. I hope this gave you some useful information and gave you the perspective from a surgeon. And if you have any questions or concerns, please comment on my YouTube channel. Take care now.